Recently, we lost talented actor and Oscar winner Phillip Seymour Hoffman to a deadly heroin overdose. And just last summer, Corey Monteith was a victim of the same fate. But drug addiction is not just a problem in Hollywood. If you look hard enough, you can find it in almost any town across the country. And drugs like heroin are becoming more and more commonplace. Family and addiction therapist Dr. Paul Hokemeyer is joining us. He's going to talk a little bit about addiction and what you can do if you know someone who is abusing drugs. Good to have you with us.
Thank you.
It's a very serious topic, and let's start, Doc, with Hollywood. Why does it seem that celebrities are so prone to addiction, from Elvis to Janis Joplin to the recent deaths that we just talked about?
Well, I think it's for two primary reasons. The first is that they tend to get lost in the world. And the second is once they get lost, they have a hard time finding their way back. The public and the people who they rely on tend to cannibalize them and turn against them.
It does seem that it is something of a sport with celebrity to watch them fail. Does that feed addiction as well?
It does, because basically they don't have the tools to cope in a healthy way. So basically what an addiction is where somebody's taking something outside of themselves to self-soothe, to self-medicate. So when they're feeling bad, when they're feeling anxious, when they're feeling depressed, they don't have the tools that they need to self-soothe, so they reach for a drug or sex or food or something outside of themselves to make them feel better inside.
Overwhelmingly, I think folks at home, and myself included, would think of heroin as a very urban drug, something most people wouldn't be exposed to, but it's becoming more and more common all over the country. Is that correct?
Right. Yeah, it's actually becoming a very upper-class, white-collar drug. It's basically, we think of it as being in very urban areas, but in fact, many professionals are using it, and the access and the availability of the drug has really exploded.
Addiction's a very tricky subject within families. How do you know if someone in your family is having some kind of a problem with addiction, substance abuse or eating or some kind of addiction?
Well, you look for behavioral changes. You look for if the person, they are no longer the person that they once were and that you knew them as. Also look for who they're hanging around with. Look at their peer group. Look at their other siblings and who they're hanging around with, because addictions don't occur in isolation. That basically they occur in systems. So know who your kids' friends are. And another thing is prescription drugs are a huge problem in this country. And most children, most teens, most adolescents are getting them from their parents' medicine cabinets. So if you're a parent, make sure you know where your drugs are, your prescription drugs are, and how many you have.
If you do think there's a problem, how do you approach it? How do you first address that with someone?
Well, it's best to be honest and direct. Addictions also occur in a system of denial and rationalization. No parent wants to think that their child is a drug addict. Right. And so parents tend to deny and they rationalize for a long time. Meanwhile, the addiction is really getting more and more severe and damaging. So be upfront. Talk about it directly. Use these opportunities that we have with celebrities in the media as a teachable moment to talk to your children about drug addiction and how celebrities who seem to have it all in the world can suffer from these very real problems.
How do you know when professional help is called for, when you really need to go to the pros and get them involved?
Well, I think early intervention is key. So if you suspect that there's a problem and you talk to your child and they're not being forthright, take them to a therapist. They may be able to be honest with that person instead of you. So I think early intervention and early education is critically important.
Dr. Hokemeyer, thank you so much. Important, difficult subject, but we've got to address it. We will be right back.